Okay, now for the fifth step in the nursing process, and that is evaluation. I know this is all mind-blowing to you. It is a lot to absorb here in this first class, but it will all come to you. And again, you're going to need this when we go to clinical. And a lot of this may not make sense to you at first until we actually start delving into some of the concepts. When we get into the concepts and we start doing things, talking about elimination, metabolism, perfusion, oxygenation, you are going to learn general interventions, assessment strategies. We will point out some of the nursing diagnosis or problems that occur with these concepts. As you go along, if you really learn this beginning concept of oxygenation, what you do for a patient that has compromised oxygenation, a patient with a problem with metabolism or with elimination, once you learn that general concept, which we're going to go over first, then you're going to learn again the pieces that fit into this nursing process. So it will make a little more sense. But again, a word to the wise, learn those concepts this unit, because oxygenation is oxygenation is oxygenation. Perfusion is perfusion is perfusion. Metabolism, even though you may have it related to diabetes or you may have it related to thyroid, you are going to do similar things. If someone is having an issue with oxygenation, you are going to have similar interventions that you are going to do. There are going to be similar symptoms that are going to present, whether it's asthma, whether it's COPD, whether it's lung cancer. So you are going just learn, just make sure you get a good base on those concepts. All right, that was a little bit off of the subject, but I think I want to interject that very frequently to you in this semester, that you've got to have this good base this semester. Again, all of this will make better sense to you as we go along. So with evaluation, we have assessed our patient, we have determined they have a problem, we have written it as a nursing diagnosis or problem statement. We have put down goals that we want this patient to achieve so that we can prevent, reduce, eliminate, or we can promote a better lifestyle related back to that nursing problem. We have implemented strategies and interventions to help reduce it, improve it, or whatever that we have in our goal. So now we have to evaluate, did what we set out to do really happen? Did those interventions make a difference? So we're going to evaluate the patient. All right, again, for some stupid reason, thank you for being patient with us. Okay, with evaluation, we have the planned, ongoing, purposeful activity in which patients and healthcare professionals determine the patient's progress toward achievement of goals or the outcome or the effectiveness of the nursing plan of care. And depending upon the evaluation, the plan of care is either going to be continued, it's going to be modified, or you're going to terminate that intervention or that problem, that nursing diagnosis problem. You're going to discontinue those interventions related to it. So we are going to evaluate and determine the patient's progress, and do we need to modify, terminate, or continue what we're doing. So when goals have been met, the nurse can come to one of the following conclusions. The actual problem in the problem statement is resolved. So let's say that the patient that we've talked about all through these presentations that has pneumonia, that has all that the sputum they're trying to get rid of, they have the problem that we set out was ineffective uh, airway clearance. So they have been started on antibiotics. They've been on antibiotics. They did have like 24 hours of IV fluids because we needed to kind of rehydrate them and help uh, get get the secretions a little thinner. The patient has increased their intake. As we are assessing them, their temperature is now 98.6 in normal, within normal limits. And when we check their lungs are clear. We are no longer hearing those crackles. So the actual problem in the problem statement is either resolved or resolving. Those antibiotics are taking care of it. The patient is coughing and deep breathing, doing their breathing treatments, and they are doing everything that we have asked them to do, and they have received the care that we have laid out in our interventions. So if the patient, then we're getting ready to, if the patient is getting close to being ready to discharge, we can actually discontinue that problem. If a risk factor is no longer present, the patient that we talked about in the earlier presentation that had the hip fracture that was at risk for constipation, we have noticed that for the last 3 days, the patient has had nice normal bowel movements. They are up, moving more. We have therapy involved. They have increased the fiber in their diet. So they are no longer at, and they have switched from an opioid pain medication to, let's say, an NSAID, which is not going to be constipated. We can say that that risk factor is no longer present and we can discontinue the problem. If a potential problem has been prevented, it can be discontinued. And I guess that risk factor and what we just talked about with the constipation, that kind of overlaps. You can see that nothing here is going to be black and white. There are things that are going to overlap. But a potential problem has been prevented. Let's say um, let's say we know the patient has a history of asthma and they are being admitted, and this is really or let's say they came into an outpatient clinic and we know this patient has a history of asthma and the patient has a little cough and the patient we think might be coming down with a viral infection. So we may want to go ahead and put them on some of their breathing treatments, their nebulizers for asthma, so that they do not have an exacerbation of asthma while they are having this viral infection. So that way, a potential problem has been prevented. The risk factor is being prevented, but the risk remains. This means that, let's say the person is immobile, they have a pelvic fracture, which with a pelvic fracture, they're not going to be ambulatory. And we know this patient likes to lay in one position all the time. So they're at risk for two things. They're at risk for a pressure sore in their pressure areas on that side which they like to lay, and they could also be at risk for pneumonia because if they're laying on that side, the lung on that side is not going to fully expand and any secretions are going to settle, so they're at high risk for pneumonia. So if the patient has not developed a bed sore or a pressure ulcer, the patient has not developed pneumonia, but the risk still remains. So we're going to continue that problem. We're going to turn every 2 hours, change positions every 2 hours. We're going to encourage coughing and deep breathing. Let's say an actual problem remains, but the goal is partially met, which might be with the patient with the pneumonia. We know the fever's down, we know the lungs are clearing, but they are still on antibiotics because that bacteria may still be there. We still want them to cough effectively. We still want them to drink a lot of fluid. So our fever is down, our lungs are clearing, but the actual problem is still there. Our goal is partially met. So we are making progress toward our goal. So we're going to continue that problem. Or the actual problem remains and the goal is being met, but the patient just needs a little more time. Say the patient has COPD and we are trying to increase their activity tolerance. We know that they're making progress, but they're just not making progress as fast as we would like. So they have partially met their goal. Let's say we wanted them in a week's time to be able to ambulate 30 feet without shortness of breath, but they are ambulating 20 feet. We know that they are going to be able to reach that goal, but it's just going to take them a little longer. So when we evaluate that goal, we are going to continue that problem. Now, do we have an actual problem and is the goal partially met, but the patient is not making any progress? Or we could actually have the problem and nothing has changed. So the patient has not made any progress. If that is the case, then we want to revise the interventions. So the question when somebody has a partially met goal or when they don't have a goal that is not met at all, that is the question we want to ask. Are you making progress toward the goal? If so, we're going to continue the problem. We may want to tweak it a little bit, but if they've not made progress toward the goal, then we want to revise those interventions and try something new. So we're always going to be evaluating what we're doing. Now, when we are in the clinical setting, you guys are going to have these patients a day. We're not going to get into the ability to evaluate these patients very well because by next week they're probably going to be home. So this may be a difficult part of the nursing process that we kind of have to talk about when we're in clinical, and you may not see the actual result of some of the uh, interventions that you come up with. So to write an evaluation statement, it's going to consist of the date and time the evaluation was done. You're going to have a supporting statement giving the results of how the patient did or did not meet the goal, and a conclusion statement about whether the goal was met, partially met, or not met. And there are examples of those statements in your textbook. The chapter of nursing process in your textbook is excellent. All of the boxes, all of the examples are just very good. I have tried in these presentations and in my PowerPoint to pull it all out and try to simplify it for you. It's very difficult material to try to simplify because it is complex, but it is part of your critical thinking, clinical reasoning, and eventual clinical judgment. And the complete resource for the nursing process was your Pearson textbook. Thank you. Study hard.